OCD stands for Obsessive Compulsive Disorder, which is a mental health disorder characterized by persistent, intrusive, and distressing thoughts, obsessions, and/or repetitive behaviors or mental acts, compulsions, that are intended to reduce the anxiety caused by the obsessions. OCD can significantly impact an individual's daily life, including their work, relationships, and social interactions. Obsessions and compulsions. Obsessions are intrusive and unwanted thoughts, urges, or images that cause significant distress or anxiety. These obsessions are not simply worries about real-life problems, but rather involve irrational or exaggerated fears, such as fear of germs, harm to oneself or others, or unacceptable sexual or religious thoughts. Individuals with OCD may recognize that their obsessions are irrational, but they feel powerless to control them. Compulsions are repetitive behaviors or mental acts that an individual feels compelled to perform in response to the obsessions. The compulsions are intended to neutralize the anxiety or distress caused by the obsessions, but they are often excessive, time-consuming, and interfere with daily life. For example, an individual with a fear of contamination may repeatedly wash their hands, which may lead to raw and chapped skin, or they may avoid touching certain objects altogether. Causes of OCD. The exact causes of OCD are not fully understood. However, research suggests that OCD may be caused by a combination of genetic, neurological, and environmental factors. Genetics. OCD tends to run in families, which suggests that there may be a genetic component to the disorder. However, no specific gene has been identified as the cause of OCD. Brain chemistry. Studies have shown that people with OCD have imbalances in their brain chemistry, specifically with the neurotransmitter serotonin. Serotonin is involved in regulating mood and anxiety, and a deficiency in serotonin may contribute to the development of OCD symptoms. Environmental factors. Traumatic events, such as abuse or illness, may trigger the onset of OCD symptoms in some individuals. Symptoms of OCD. Some of the common symptoms of OCD include obsessions, intrusive and recurring thoughts, images, or impulses that cause distress or anxiety. Compulsions, repetitive behaviors or mental acts that an individual feels compelled to perform to reduce the anxiety caused by the obsessions. Excessive cleaning, washing, or sanitizing to prevent contamination. Repeatedly checking things such as locks, switches, or appliances to ensure they are turned off or locked. Counting, organizing, or arranging things in a specific order. Needing everything to be symmetrical or balanced. Intrusive sexual, violent, or religious thoughts that are distressing. Diagnosis. OCD is diagnosed based on the presence of obsessions and/or compulsions that are time-consuming, cause significant distress or anxiety, and interfere with daily life. The diagnosis is made by a mental health professional, such as a psychiatrist or psychologist, who will conduct a comprehensive evaluation, including a physical exam, psychological evaluation, and a review of the individual's medical and family history. Treatment. OCD can be effectively treated with a combination of psychotherapy and medication. The most common treatments for OCD are cognitive behavioral therapy, CBT. CBT is a type of psychotherapy that is based on the idea that thoughts, feelings, and behaviors are interconnected. CBT for OCD typically involves exposure and response prevention, ERP, a type of therapy that gradually exposes the individual to their obsessions and teaches them new ways to respond to the anxiety caused by them. ERP helps individuals learn to tolerate the anxiety caused by their obsessions without engaging in compulsive behaviors. CBT may also involve cognitive restructuring, which helps individuals identify and challenge negative thoughts and beliefs that contribute to their OCD symptoms. Medication. Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed medications for OCD. These medications work by increasing the levels of serotonin in the brain, which can help reduce anxiety and compulsive behaviors. Other medications, such as tricyclic antidepressants and antipsychotics, may also be used in some cases. Deep brain stimulation, DBS. DBS is a surgical procedure that involves implanting electrodes in the brain to stimulate specific areas. DBS has been shown to be effective in reducing OCD symptoms in some individuals who have not responded to other treatments. Living with OCD. Living with OCD can be challenging, but with the right treatment and support, individuals with OCD can manage their symptoms and lead fulfilling lives. It is important for individuals with OCD to seek treatment from a mental health professional who specializes in OCD. Support groups, such as the International OCD Foundation, can also provide helpful resources and connections to others who are living. Subscribe for more informational videos.